Psychological disorders. Number 1. Stendhal syndrome. Stendhal syndrome, or Florence syndrome, is a psychosomatic condition involving rapid heartbeat, confusion, hallucinations, and even fainting. This allegedly occurs when an individual becomes exposed to objects or phenomena of great beauty. The affliction is named after the 19th century French author Stendhal, pseudonym of Mary Henry Bell, who describes this experience with the phenomenon during her 1817 visit to Florence, Italy. In this book, Naples and Florence, A Journey from Milan to Reggio, when he visited Basilica of Sante Croce, where Michelangelo are buried, he was overcome with profound emotion. Stendhal wrote, "I was in a sort of ecstasy, absorbed in the contemplation of sublime beauty. I had palpitations in my heart, life was drained from me, I walked with fear of fainting." Though there are numerous accounts dating from the early 19th century, the phenomenon of people fainting while taking in Florentine art was first named in 1979, when it was described by Italian psychiatrists, who observed over 100 similar cases among tourists. There is no evidence to define Stendhal syndrome, and it is not listed as a recognized condition. However, there is scientific evidence that some cerebral areas involved in emotional responses are stimulated during exposure to art. A more recent account of Stendhal syndrome was in 2018, when a visitor to the gallery in Florence suffered a heart attack while admiring Botticelli's The Birth of Venus. Number 2. Apotemnophilia. Apotemnophilia, also referred to as BID, body integrity disorder, and formerly called amputee identity disorder, is a rare mental condition characterized by a desire to have a sensory or physical disability, or feeling discomfort with being able-bodied, resulting in harmful consequences such as self-amputation. People with this condition may refer to themselves as transabled, but the term is controversial. Symptoms: desire to have a sensory or physical disability. Complications: self-amputation. The usual onset of this mental condition is 8 to 12 years old. Treatments include cognitive behavior therapies and antidepressants. Some become somewhat confused and more comfortable with their own bodies by using prosthetics and other tools to help with their dysphoria, such as using a wheelchair or by blocking their vision or hearing. Some people with BID have reported to the media that they have resorted to self-amputation, for example, allowing a train to run over or otherwise damaging their limbs so severely that a surgeon will have to amputate it. However, the medical literature records very few cases of self-amputation, apart from that of the cricket historian Roland Bowen, who self-amputated one of his legs below the knee in 1968. BID has been featured in fictional series on television. Psychiatric Dr. Charles treats a man with BID in Chicago Med, Season 1, Episode 13, Us. BID has been portrayed in various media formats. Representations in literature, following selections, describe notable appearances of BID across different medias. Fictional literature, specifically focusing on BID, is rare. Career of Evil by Robert Galbraith, pseudonym of J.K. Rowling, references BID. Number 3. Alien hand syndrome. Alien hand syndrome, or Dr. Strangelove syndrome, is a category of conditions in which a person experiences their limbs acting seemingly on their own. The affected person sometimes reaches for objects and manipulates them without wanting to do so, even to the point of having to use a controllable hand to restrain the alien hand. The occurrence of alien hand syndrome can be usefully conceptualized as a phenomenon reflecting a functional disentanglement between thought and action. Alien hand syndrome is best documented in cases where a person has had two hemispheres of their brain surgically separated, a procedure sometimes used to relieve the symptoms of extreme cases of epilepsy and epileptic psychosis. It also occurs in some cases after brain surgery, stroke, tumour, and migraine. To deal with alien hand syndrome, some individuals engage in personification of the affected limb. Usually these names are negative in nature, from mild such as cheeky to malicious monster from the moon. For example, Rachel Doody and Jankovic described a patient who named her alien hand Baby Joseph. When the hand engaged in playful, troublesome activities such as pinching a kitten to biting while nursing, she would experience amusement and would instruct Baby Joseph to stop being naughty. Furthermore, Bogan suggested that certain personality characteristics, such as flamboyant personality, contribute to frequent personification of the affected hand. In Stanley Kubrick's 1964 film Dr. Strangelove, The title character, played by Pete Sellers, apparently had alien hand syndrome, as he could not stop himself from doing the Nazi salute. Dr. Strangelove syndrome was suggested as the official name. This was not approved, though sometimes is used as an alternative name. In the medical drama series House episode Both Sides Now, a patient has alien hand syndrome. Number 4. Capgras syndrome. Capgras delusion or Capgras syndrome is a psychiatric disorder in which a person holds a delusion that a friend, spouse, parent, or other close family member has been replaced by an identical imposter. It is named after Joseph Capgras, the French psychiatrist who first described the disorder. The Capgras delusion is classified as a delusion misidentification syndrome, a class of beliefs that involves the misidentification of people. Cases in which patients hold the belief that time has been warped or substituted have also been reported. The delusion most commonly occurs in individuals diagnosed with a psychotic disorder, usually schizophrenia. It presents often in individuals with a neurodegenerative disease, particularly at an older age. In one isolated case, the Capgras delusion was temporarily induced in a healthy subject by administration of ketamine. Capgras syndrome, named after a French psychiatrist who first described the disorder in 1923, where they described the case of a French woman, Madame Macrae B., who complained that corresponding doubles had taken the places of her husband and other people she knew. Capgras first called the syndrome illusion dissociis, which can be translated as the illusion of doppelgangers. The syndrome was initially considered a purely psychotic disorder, the delusion of double seen as symptomatic of schizophrenia and purely a female disorder, though this is now known to not be the case. Symptoms of Capgras delusions include a genuine belief that a close relative, friend, or significant other has been replaced by an imposter, refusing to talk in the presence of the believed imposter, and refusing to accept any evidence that shows the believed imposter is not an imposter. Number 5. Alice in Wonderland syndrome. Alice in Wonderland syndrome, also known as Todd syndrome, is a neurological disorder that distorts perception. People with this syndrome may experience distortions in their visual perception of objects, such as appearing smaller or larger, or appearing to be closer or farther than they are. Distortion may also occur for senses other than vision. The causes of Alice in Wonderland syndrome is not currently known, but it has often been associated with migraines, head trauma, or visual encephalitis caused by Epstein-Barr virus infection. Alice in Wonderland syndrome is also possible to be experienced temporarily under the cause of certain psychoactive drugs. Although the cases of Alice in Wonderland syndrome in both adolescents and adults, it is most commonly seen in children. Individuals with AIWS can experience illusions of expansion, reduction, or distortion of their body imagery, feeling that their own body or body parts are shrinking, feeling that their own body or body parts are growing or becoming larger. These changes in perception are collectively known as metamorphosis, which refer to objects appearing either smaller or larger than in reality. For people with neurological diseases, they may also experience similar visual hallucinations. Alice in Wonderland syndrome was named after Lewis Carroll's 19th century novel Alice's Adventures in Wonderland. In the story, Alice, the titular character, experiences numerous situations similar to those of microsia and macropsia. The thorough description of metamorphosis clearly described in the novel were first of their kind to depict the bodily distortions associated with the condition. There is some speculation that Carroll may have written the story using his own direct experience with episodes of micropsia resulting from the numerous migraines he was known to experience. It has also been suggested that Carroll may have had temporal lobe epilepsy.